Hi. So right now we are going to talk about a very important class of platyhelminthes called cestodes, and cestodes are tapeworms. And tapeworms have the following different types. Okay, Diphyllobothrium latum, Taenia solium, Taenia saginatum, Echinococcus haemophilus nana. So let's just begin with D latum, okay? And why I'm saying that, because when we proceed, we are going to proceed from intestine, going all the way to the liver, and then again to the CNS. All right. So Diphyllobothrium latum. One thing I want you to understand about Diphyllobothrium latum is that some important MCQ points before we directly jump into the disease itself is that it's first of all the longest tapeworm. Okay, it's seen in dogs, cat, fox as definitive host in their GIT. Intermediate host is your cyclops, and your secondary host, first intermediate host, and the second intermediate host is going to be a freshwater fish. Okay, so here there are two intermediate hosts. Now what happens is that, let's say you ingest this food, this fish, and it's poorly cooked. So that's when you get the disease. So what is going to be the infective form? An infective form is a larva. It's called plerocercoid larva. Okay, and that infective form goes in, and then in the small intestine you have the adult worms. Then they form operculated, unembryonated. This is very important. Eggs. Okay, so very important is two important things: plerocercoid larva and worm, and then egg. What is the symptom? The symptom is simple B12 deficiency. Why? Because it affects the ileum. Simple as that. First things, you see a B12 deficiency, you see a sensory defect, you see tingling, you see anemia, megaloblastic anemia, you want to hit, and there is association of fish, or there is an association of parasitic disorder, straight up go for it. How do you want to diagnose this? You want to do a stool. You want to do a stool examination. And what do you see? You see operculated, unembryonated egg. Okay, and they are bile stained. Plus bile stained. Do these eggs float? No flotation. There are some important points about this flotation and not being able to float that we'll talk about. You can also see certain amount of proglottids release, and proglottids are segments of the adult worm. You can also do a PCR, which is also good enough. And if you want to treat, you want to do drug of choice as praziquantel. Again, the wonder drug. Also, what you can do as alternative is a niclosamide. A niclosamide is also a good alternative to praziquantel. Okay. And okay, so I'll just write the name: Niclos. NICLOS, niclosamide. And then you also want to make sure that you give him B12, because your B12 deficiency is the one that's causing all the disease. As a whole, the Diphyllobothrium latum is notorious for causing B12 deficiency itself. So that's an important point. Now the two important cestodes that we want to talk about is T. solium and T. saginatum. Okay, I like to remember T. solium as the pig and T. saginatum as the cow. Pig is more aggressive, cow is more shant or labile. Okay, so therefore, first thing first, it's it's pig or pork. This is beef. This is pig, so it's an armed tapeworm, so it's going to have a scolex. This is an unarmed tapeworm. So what is scolex? It's going to have hooklets, scolex present with hooklets, plus hooklet, positive rostrum, the sucking disc. Here none of it is present. Okay, this is expelled passively, as in the gravidim segment. If this is asked, expelled passively, this is expelled actively. Okay, what area is affected? Again, both of them have the same area, jejunum ileum, jejunum plus ileum. Okay, so what happens is that again there is a very important infective form, and it's the cysticercus. Okay, and circus is the way I remember cysticercus, whereas when it was there for Diphyllobathrium, we remember plerocercoid larva, because the larva itself is infecting, so we do not need to remember much. But here is circus, and in the circus you see animals, and letting your imagination run a little wild, you see a pig also and a cow also in the circus. So fair enough. So this is the circus larva, the circus circoid larva, that is going to infect, and when it gets it, it forms the adult scolex worm in the intestine, and with the help of the scolex it attaches to the intestine, and then it starts sending out eggs or proglatid or segments. Okay, proglottids. So when it's sending proglottids, okay, in the stool, this is what you will diagnose. And again they are bile stained. Again they do not float, no float. Okay, and again it is a very important that they have an hexacanth oncospore. Oncospore. That means you have an embryo 4, and there are like 6 hooklets, 6 very important hooklets that are surrounded by a radially striated. So this is an hexacanth oncospore. Now hexacanth oncospore, how do you remember this? So how I remember it is in the circus. In the circus there is a lot of wheels, and the wheels, and they are making the pig run on the wheel. So the pig has, and so does the cow, have a lot of wheels, and that's basically it. Again, if you want to do a treatment, you want to do praziquantel. Why? Because prazis or praziquantel is given at the circus. And how do you want to diagnose it? You want to do antigen detection, you want to do ELISA. So check for your copro antigen. Copro antigen was also seen somewhere else, if you remember. It was, if I'm not wrong, it was also seen along with giardia. Okay, and do a PCR obviously, and that's about it when you talk about Taenia solium. Now Taenia sagginatum. Now this Taenia solium is really notorious because, let's say you ingest it, okay, and what do you ingest is meat, and you ingest meat which has what? It does not have the cysticercus. The meat actually has a very important egg. Okay, the egg meat which has the egg of T solium. Now if the egg is itself, or there is feces that you ingest with egg, usually the cysticercus are something that you ingest, right? The cysticercus that you ingest, cysticercus containing tissue, so then that's fine. But what happens is that sometimes you ingest meal with eggs of T sodium. That is you ingest meat containing eggs. That is in the case of, let's say, if there is an egg present in probably the feces, okay, in the feces of a pig, or the pig has eaten eggs that has the feces, and then the eggs have been consumed and they reach the muscle layer. Okay, so somehow man ingests eggs in feces, okay, or he ingests a meat with eggs of T solium, or food or water that's contaminated with eggs of T solium. So what you would have is that you would get a very important, eggs would develop into cysticercus, because that's the eventual, and this was usually the infective form, but now this is already present in the body. So this goes in any organs, it goes into organs, especially the brain. and it forms a neurocystic circus. So if you can't remember the name, I'm pretty sure you've heard of this disease, neurocystic circus. Now neurocystic circus is a parenchymal or even a ventricular 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 as in the brain ventricle disease, which causes hydrocephalus, or if it's a parenchymal it can cause seizure, even neurological deficit, or even motor deficit, okay, or sensory motor deficit, both. So, or it can cause, if it's in the arachnoid space, it can cause subarachnoid space, it can cause meningitis. So yes, this is a very dangerous disease. Okay, so you want to keep that in mind. Okay, if it's hydrocephalus, it'll cause increased ICP, and because of increased ICP, there can be a lot of projectile vomiting, hypertension, vertigo, etc. So what other thing can actually occur? Muscular cysticercosis can occur. That there you will have muscular pain, you'll have pseudo hypertrophy. Okay, that's important. Apart from that, okay, you can have ocular cysticercosis, where there'll be protrusion, there'll be nodules actually, and those nodules that could be present in either the sclera or conjunctiva. Okay, so they will cause a lot of irritation, okay, and that will lead to diplopia, that will lead to loss of vision, okay, and finally also there'll be some monoproptosis. I was about to write proptosis, but I stopped because I had to explain the concept. So these nodules are present at various structures, and they can push the eyelid forward to cause proptosis. They also cause loss of vision and diplopia. How do you want to diagnose? You do a CT MRI, directly detect for the lesion, okay, or you can also detect the antibodies, okay, or you detect the antigen. How do you want to treat? You want to do an albendazole. Now finally we've come to another drug apart from a praziquantel. We have said albendazole. You can also obviously go for a very praziquantel, that's a very sensational drug. But listen, there has to be a very important way of treating this patient. If you first do a glucocorticoid, okay, and then you go for alb. Why? Because glucocorticoid is followed by albendazole is better, because let's say you give albendazole first, there's going to be a lot of damage to the cysticercosis, and that can cause a reaction, okay. So to prevent that, you want to give glucocorticoids. Now coming to the very important, we've got echinococcus granulosa. Okay, got it. Now when you look at echinococcus granulosa or dog tapeworm, alright, or dog tapeworm, it's a simple concept. It's present in dogs, in the GIT of dogs, in the small intestine of dogs. So what is the concept? The concept is really basic. Okay, what is it? The concept is that the dog's feces is accidental ingested by man. Simple. So the dog feces has a certain infective form, which is the egg. So this egg is ingested by man. Now the man develops a hydatid cyst. Okay, so obviously the egg is come into the GI tract, it forms an oncospore tries to various parts to form an hydatid cyst. And where does this actually be formed? It's in the liver or probably even the lungs. Now, an echinococcus multilocularis, we'll see that it is also formed in the lungs. Okay. Right now we are seeing echinococcus, okay, granulosa, that is in the liver. But echinococcus multilocularis can also be in the lung, and it can also be in the liver. Okay. But this very important H. nana, okay, H. nana is somewhere. We'll talk about H. nana, but I really want to speak about H. nana is because there is a way that we are trying to identify the two, correct? We're trying to differentiate the two as well. So it's a dwarf tapeworm, okay, and what it does actually cause is it causes, it's usually asymptomatic. H nana, okay. I'm just trying to speak a little on H nana because I used to get confused about H nana and Echinococcus granulosus. Okay, there is abdominal pain in H nana. There's a lot of GI symptoms in H nana, but not here. Not here. Definitely not in Echinococcus. Okay. So let's continue on talking about Echinococcus. And what I was talking about Echinococcus is that Echinococcus is forming a hydatid cyst in the liver. Now, what is the hydatid cyst ka issue? Okay, where is it formed? First of all, hydatid cyst. Okay, that's, you need to understand what hydatid cyst is. We saw how your neurocystis sarcosis. Okay, it's very different because the cyst has three layers: one, two, and the third layer. The outermost is the fibrous adventitial layer. The middle is the inner is the acellular laminated layer. Okay, acellular laminated layer, and the middle is the germinated nucleated layer. Okay, it's not that important. It's just important to understand what this is. So there is going to be an endocyst, there's going to be an exocyst, and then there's going to be an ectocyst or a pericyst. Now I'll just explain the entire thing again because I think I may have missed a few points as well. So the outermost is the pericyst, this is the ecto, this is the endo. Peri is the adventitious layer, ecto is the acellular laminated layer, and the innermost or the endo is the germinated layer, germinal layer. Simple. Germinal is always inside, fibrous is also always outside, and the last you can obviously get by adventitious, acellular laminated layer. Okay. How do you want to diagnose? Do an CT, MRI, or you use an USG, most commonly done. Now, on a CT, you will see a water lily sign. This is something that does come, water lily sign. I'll have to show a CT. You could just Google that on a CT scan, a water lily sign. Hardly looks like a water lily for me. Okay, you could also do a serology and you want to check for you could want to check for antibodies, or you could do a PCR. How do you want to treat? You want to do something called as a PAIR. You want to do PAIR, which is called as puncture, aspiration, infusion, reaspiration. So first you puncture the hydatid cyst. Okay, you cannot directly aspirate it. You cannot directly aspirate the hydatid cyst because there is a lot of anaphylactic reaction. So you do puncture, then you aspirate some, and then you inject. Okay, first you aspirate a little bit to just see if you've punctured it right, a little bit. Okay, and then you reaspirate. You inject a lot of scolicidal agents like 95% alcohol or cetrimide or even hydrogen peroxide or sodium hypochlorite, and then you again reaspirate, and then you reaspirate the entire content. Okay, sometimes what you have to do is that this patient, they'll come to you as hepatomegaly. They'll say hepatomegaly, and they'll also say that there might be some of portal disorders, portal hypertension. There can be also obstruction of the biliary tree. There's obstruction of the biliary tree, and there can be certain allergy or bacterial, and also secondary bacterial infection. If let's say if this has reached the lungs, it can cause even go to the bronchus. Now the same variant of Echinococcus granulosa is multilocularis, E. multilocularis, and here you will have a lot of multilocular cysts. Okay, multilocular. The only difference is multilocular cyst in liver. Okay, and it can also be in the alveoli. Okay, so it's called alveoli like morphology, and again you just do pair, and you want to make sure you give albendazole as your treatment, but pair is obviously your treatment. PAIR are the puncture, aspiration, injection, and reaspiration. Okay, after we've spoken about that, let's talk about H nana and wrap the entire topic. Okay, H nana. Okay, the stool. Yeah, obviously we had to talk about the eggs. Do we have to talk about the eggs here? Obviously not, dude. How will we talk about the eggs? There are no eggs in Echinococcus. So let's just directly go on H. nana. So first of all, I want to talk about the stool of H. nana. The stools obviously are seen in H. nana. So what kind of a stool are there? Finally, you'll understand why I was straining so much upon bile and non-bile. It's non-bile. Again, this has an hexacanth oncosphere. Oncosphere. Okay. Okay. Does it float? Yes, it floats. And this is why I was saying float. This is exactly why I was saying it floats. So I've got a mnemonic to understand what eggs are bile stain, what float. The eggs that are having an operculum, as I told you, are all operculum are all of the trematodes except schistosomias, and Diphyllobothrium latum is also showing operculated eggs. It's also showing operculated eggs. Which eggs show embryonated, non-embryonated is another question. But is it that important? Probably not that important. Okay. But if you want, we can say that most of the eggs are unembryonated, except Clonorchis and Ophis clonus that are embryonated. So Clonorchis is the one that's embryonated. Okay. The other ones, that's the fasciola, the fasciola group. They are usually, not usually, but always, okay, they are unembryonated. Okay. What about the lung fluke? Is that unembryonated? Yes, that's also unembryonated. All of them are operculated. That I already spoke of. Ophisthochus and Clonorchis are the embryonated. I'm again making it a point. What about schistosoma? Schistosoma, is it embryonated? Is it non-embryonated? Well, schistosoma, the eggs, okay, the eggs that can be present is actually, obviously it's non-operculum, okay, and it does not have an operculum, and you do not use the diagnosis. What diagnosis is that we see that which is acid fast, okay, so S. manosi is acid fast, okay, but again that's not so important. It's non-operculated and it has a spine. So what we are looking at is spine when we are looking at the schistosoma eggs. Mansoni, Japonicum with no spine, Mansoni with a spine, and Hematobium with a terminal spine. That's what we are looking at when we are looking at the eggs, correct? But if you are looking at the stool, okay, of schistosoma, one thing is important to understand: the S. manosi is also Zn stained, and so Tinea solium and Tinea saginatum, they also are eggs that are bile stained. Okay, they are bile stained eggs. They have a hexacanth engosphere. But a very important point is that T. saginata, just like Schistosoma mansoni, is also acid fast. So this is another important point. So I want to talk about these eggs because these eggs are a lot of they used to piss me off when I was a second year MBBS. So they used to piss me off and they used to tell me that, okay, so you tell me which is bile stain, which is non-bile stain, which floats. Okay. For that we have the MCQ. Neha hates. F means an abuse, and that is going to help us to understand why I'm using this abuse also. So it's slightly inappropriate, but I think as long as it helps us get those 4 marks in the MCQ, that's all we care. So Neha is Nikator. I'm looking at N for Neha, N for non-bile. Most of them are bile. E is enterobius. Okay, don't you tell me entamoeba. They don't have an egg. They have a metacystic trophozoite and cyst. Okay, they don't have eggs. So that's simple as that. H. nana that I just spoke about, and A is ankylostoma. duodenale. Hates is the one that floats. Okay. Someone who does not know how to swim, they cannot float, and that's why they hate swimming. That's how I remember. It's really stupid. But again, H nana, A is ankylostoma, T is trichurus, E is enterobius, again the same. S is ascaris. So hates, I know ascaris is with A, but ascaris. Okay, but what ascaris? Which, so F is hates, Neha hates, beep, FA beep. So ascaris is the fertilized, because you know what I mean, correct? Fertilized egg and the abuse itself, the cuss word. So that's about it for H nana. Oh yeah, obviously the symptoms of H nana, you would ask me, okay. Oh well, it's asymptomatic. It's asymptomatic usually. And so what are the clinical manifestations? Actually, they just develop anorexia, abdominal pain, diarrhea, stuff like that. Where is it seen? Where is it actually infecting? Well, the eggs are released, okay? The eggs are released in the intestine. Correct. And it can have a lot of auto infection, reinfection, external infection. So that's why I think the only question that can come from here is about, is it bile stained or not for H nano. And if you want to treat this, you want to do a praziquantel again. So we have seen praziquantel literally everywhere except in the albendazoles, that is the T-solium saginatum. And then obviously you could do your niclosamide to wrap it up. And I think that is about it. Thank you very much. See you when we're talking about now we've spoken about the platinum, and now we'll talk about Nematohelminthes.